Hello and welcome! Have you ever sat in that big chair at the eye doctor's and wondered what's really going on? With all the different machines and questions? Well, today, we're going to pull back the curtain. We're taking a step-by-step journey through a typical eye exam to show you exactly what it's all about. It usually all starts with something that just feels off. Maybe your eyes are always red, or your vision is getting a little blurry around the edges, or maybe it's a nagging pain you just can't shake. These are little signals, right? They're clues from your body that it's probably time to get things checked out. And that's exactly what an eye exam is. It's not just some routine procedure. Think of it more like an investigation, a journey to figure out the story your eyes are trying to tell and get to the bottom of those symptoms. Okay, so let's kick off our journey right at the beginning, the symptoms. These are the things that actually get you to pick up the phone and make that appointment. Honestly, they're the most important first pieces of the entire puzzle. So this covers most of the usual suspects. But let's zoom in on that one in the middle, astigmatism. It's a fancy word for that feeling of eye strain, tiredness, and even headaches you get, especially after staring at a screen. This is a huge clue for something like uncorrected astigmatism, where your eye is shaped more like a football than a basketball. It means your eye is constantly fighting to focus, and that gets exhausting.
So, you've told the doctor what's been bothering you. Now the actual exam begins, at the most familiar stop for all of us, the classic eye chart. It's time to see how well you can actually see.
The whole point of this is to test your visual acuity. It's the fundamental benchmark, the baseline for your vision. We're figuring out how good your eyes are at seeing fine details clearly. It's about way more than just passing a driver's test. It's step one in understanding your eye's most important job. And what about those numbers, like 20/20 or 20/40? This chart breaks it down perfectly. All 20/40 means is that to see something clearly, you have to be at 20 feet, while someone with normal vision could see that exact same thing from 40 feet away. See? It's actually a pretty straightforward way of measuring something so incredibly complex.
All right, so we've checked your vision from a distance. Now it's time to zoom in, way in. The doctor needs to get a really close look at the very front part of your eye.
And they do this with this incredible machine called a slit lamp. The best way to think about it is like a superpowered microscope for your eyes. It shines a thin little slit of light onto your eye, which lets the doctor see everything: the cornea, the iris, the lens, in magnified 3D. It's all about spotting any tiny imperfections. But what if an injury is so small or so subtle that you can't see it, even with a powerful microscope? How in the world do doctors find that? Well, this is where they use a really clever trick.
They use a special orange dye called fluorescein. And here's the cool part. This dye only sticks to damaged cells on your eye's surface. So when the doctor shines a special blue light in your eye, any little scratch or abrasion literally glows bright green. It's an amazing way to make the invisible suddenly brilliantly visible.
The slit lamp is also the main tool for diagnosing one of the most common eye conditions out there, especially as we get older: cataracts. And a cataract is really simple. It's just when the natural lens inside your eye, which is supposed to be totally clear, starts to get cloudy.
And this slide just shows it perfectly. A healthy lens is like looking through a sparkling clean window. Easy, right? But a cataract makes that window foggy, or even frosted over. The light gets scattered all over the place, and that's why vision gets blurry and colors start to look faded.
Okay, now we're moving on to a test that, let's be honest, can make people a little nervous, but it is absolutely essential for the long-term health of your eyes. We're going to talk about checking the pressure. I think we've all been there, right? You're sitting in the chair, and then, poof, that sudden puff of air. It feels a little weird, for sure, but it serves a really important purpose. It's a super fast, totally non-contact way to get a quick read on the pressure inside your eyeball.
The proper name for this is tonometry, and what it's looking for is high intraocular pressure, or IOP, which is a huge risk factor for glaucoma. Think of it like checking the air pressure in your car's tires. You need some pressure, but if it gets too high, you risk some serious damage down the line.
Now that puff test is a great screening tool, but the real gold standard is this: applanation tonometry. After a quick numbing drop, the doctor uses a tiny, flat-tipped prism that very gently touches the surface of your eye. It sounds a lot more intimidating than it is, and it gives an incredibly precise measurement.
So, we've checked your vision, we've looked at the front of your eye, we've checked the pressure. Now our journey takes us to the most incredible part: a direct look at the very back of your eye.
This part of the exam is called a fundus examination. Your pupil basically becomes a little window, and by looking through it, the doctor can see the delicate, amazing structures inside, your retina, your optic nerve, all of it.
And what a view it is. The doctor can see the optic disc. That's the spot where the optic nerve, basically the data cable to your brain, plugs in. They can see the health of your tiny blood vessels and check on the macula, the special little spot you need for all your sharp, detailed vision.
And this right here is what makes this part of the exam so unbelievably powerful. It's a well-known saying in medicine that the eye is the only place in the entire body where a doctor can look directly at a nerve, an artery, and a vein, all in their natural state, without having to do any surgery at all. It is literally a window into your body's health.
And there you have it. The journey is complete. We started with your symptoms, we moved through all the tests of how your eye is functioning and what it looks like up close, and we ended with this profound look deep inside. Every single step provides a critical piece of the puzzle, and it all comes together to tell the full story.
So you see, an eye exam is so much more than just checking if you need glasses. It's a powerful health screening. Which really just leaves one final, very important question. When was your last look inside?